In today's Health Watch, summer means it's peak tick season, and the number of tick bites is soaring this year. Emergency room visits for bites are the highest in nearly a decade as ticks spread into new parts of the country. But help to fight diseases from ticks may be on the way. That's the good news. CBS News medical correspondent Dr. Celine Gounder is here. She's also editor-at-large for public health at KFF Health News. Good morning, doctor. So is it global warming? Is it increased number of deer out there? What's causing these increased number of ticks?
Well, all of the above. And already in April, we had seen emergency room visits up more than 25% from the same time a year ago. So this is really on the rise. And it's a combination of climate change. So you have warmer weather. Land use patterns are also changing where we're moving out into the exurbs. So you have more contact with the woods, with deer in your neighborhoods. And as the weather gets warmer, you have the push of ticks up towards the north and the west because your milder winters are allowing for ticks to move in some other regions.
I've heard people say if I'm not out in the woods, I don't need to worry about it. Do you think that's true, number one? Then we hear something about the government has a plan to combat and fight the Lyme disease. Your thoughts on that?
So on the first, you don't necessarily have to be in the woods where you have tall grasses, leaves, really any kind of vegetation. Ticks can be hiding in there, and so keeping some distance, having some sort of buffer between your home and maybe some of those plants and so on is not a bad idea. Now, the government has announced a plan now to combat ticks and Lyme disease specifically. So money for tick control, new research, as well as a goal to cut Lyme cases by 25% by 2035. Now, this kind of prevention work is really overdue. One piece that infectious disease specialists are concerned about is that the HHS website for this plan is directing people to go to a directory of providers who specialize in chronic Lyme. Now, think of this a little bit like long COVID. There's damage that can occur after an infection. That doesn't mean you still have the infection. And a lot of patients with chronic Lyme are getting treated with antibiotics, sometimes for months to years, which is really high risk in terms of increasing risk of bloodstream infections. It's not good for your gut microbiome. And so I would really caution strongly against that kind of treatment. It's not to say chronic Lyme's not real, but that's not the appropriate treatment.
I think it's important. Oh, go ahead. Yeah.
No, go ahead.
I was going to say, if you're hiking, if you're playing golf, if you're camping or whatever, what should you do if you find a tick?
Yeah, so first of all, you should probably be trying to prevent that in the first place. So wear long sleeve, long pants, light colors so you can spot the tick on the pants. Okay. Wear insect repellent.
Long sleeves not fun in the summertime, though.
I know.
Okay.
I hear you.
Gayle got her arms out right now.
Right, there are thinner fabrics, lighter fabrics, but insect repellent with DEET or Picardin or another EPA-registered repellent. Do a full body check when you come indoors. If you have pets with you, check your pets as well as your clothing, and put your clothing in the dryer on high heat for 10 minutes to kill them. And then if you do find a tick, you don't want to twist it off. Grab it with a tweezer as close to the skin as possible so you don't leave anything behind. Wash it off. And then if you develop fever or rash, you need to see a doctor.
Call somebody.
Because you can get a tick bite and not even feel it.
Yeah.
I was 5. I had one in my hair for I don't know how long that my mom found. I had no idea I had it.
Real quick, what are you hearing about the vaccines for Lyme disease?
Yeah, so there's a vaccine being submitted, we hear, to the FDA later this year and might be available to the public by 2027, so next year.
Hope so.
Yeah.
So thank you very much, Celine.